In the heart of Dublin, the flats, still home to thousands. Behind the facades, the fabric of these buildings cannot cope with modern living. In the boom years, public-private partnership was to deliver regeneration. But when the bubble burst, partnership collapsed and the flats were left, their problems to fester, their tenants in limbo. In the shadow of Croke Park, Croke Villas captures the state of play. As millions were poured into Croke Park for redevelopment, Croke Villas was relegated to the sideline. The plan was detenanting, demolition, development. In some flats, only detenanting came to pass. The promise of regeneration broken, conditions worsened, while the drive to detenant made ghost estates out of former inner-city heartlands.
Detenanting was probably one of the worst things that was allowed to happen in the years when public-private partnership was on the table. The housing stock was allowed to run down.
In the south inner city, St Teresa's Gardens had over 800 residents in 2007. With detenanting, less than half remain. James Humphrey is one of those. He and his family are left coping with being left behind. Damp and mould have now moved in.
And as you can see, the damp is just all over the place. It's been like that for ages, for over a year, 2 years. Just, you can wipe it and it just comes back. It's just terrible. It's not good for your health anyway.
James and his partner Sarah live here with 5 children.
This is the girls' room. The 2 girls' room, and as you can, the damp is all there in the corner. It's behind this wardrobe. It's all at the top. All the damp down there, and these are only brand new wardrobes. Maybe it's 7, 8 months ago, and as you can see, there's nothing you can do.
Himself has asthma, and we're in a damp room.
Actually be affecting their health. You have other problems such as rats. 8 out of 14 blocks actually have suffered from rat infestations.
With no new momentum for regeneration, residents feel abandoned.
The fear of actually losing the heart and soul of the community.
Down the road, Dublin's second largest flat complex, Dolphin House, has over 400 homes. Here most tenants stayed put, but the strong community here is paying a price. These walls too hide the same structural problems.
Dolphin House is great sense of community, you know.
And good people have to come out here, like.
There's a lot of downsides. There's mould, damp, storage, condensation, and it's very, very bad. And, you know, it's been going on for years. And there, onwards, having her in the room with the mould and my son doesn't help. It's very worrying, you know, as a mother, knowing that where you're living, especially having to sleep, you know, in the night you're breathing, you know, it's horrible.
Sabrina got a letter from the hospital's respiratory clinic urging support for her in finding mould-free living quarters for her daughter.
It states on the letter the mould is affecting her well-being and her asthma. She's 3 years of age.
And across this way.
Went down to the doctor, another chest infection, another asthma attack, more steroids. So it's frustrating.
But the community in Dolphin was more organised. It commissioned a report on the conditions they lived in. Last year, samples were taken and analysed. We showed the outcome of that analysis to one of the state's leading clinical microbiologists.
These are conditions that you would get in a refugee camp, I suspect. Nobody should be exposed to these conditions for any length of time. I think you should just not be exposed to these conditions. Mostly these will cause allergic type reactions, and it will aggravate or even establish asthmatic attacks and so on.
A recent survey in Dolphin found 45% of adult residents have a respiratory problem themselves, while 42% have children with one. And that's not all. Here's Michelle and her daughter Kaylee, who was born with a condition requiring constant care.
She needed a lot of surgery when she was a baby, so she requires washouts. It's where our stomach needs to be emptied out, and to put a tube to her stomach and give her, it's like a bag of fluids, make up the solution with water myself, and she sits on the toilet and I clean her out. Some weeks she could be on every day, and some weeks it could be 5 times a week. It depends on how sick she is. But she used to sit in the toilet. It could take up to 40 minutes to an hour, and then sometimes after that she wants to have a bath. And she used to go in and sit in the bathroom. And it's quite cold and damp. And about 2 years now, actually, she's been suffering from kidney infections, urinary tract infections, which I think myself it's from the dampness. She hasn't got the bathroom facilities that she needs.
These are the facilities Michelle and her daughter have to cope with. Foul water and sewerage is backing up pipes. Residents report that specialist drainage equipment had to be called out to Dolphin House over 100 times last year.
I've had sewerage come up my bats because I was literally crying to them on the phone about it, because I can't have everyone's waste coming through my bats. I'm afraid of what Kaylee could catch or Klein, the two of them, what they would catch from that.
Consulting engineers found extremely polluted wastewater backup. They said the concentration of fecal coliforms was consistent with that found in raw sewage.
When we went to have the wastewater analysed,
nobody wants to live and wash in faeces, dilute or otherwise, and therefore it's entirely unsatisfactory.
Over the years since the first report was published, there has been no real improvement.
The report found that 90% of the flats here in Dolphin House had sewage and dampness problems. That was in May last year. We came back a year later, did the survey again, and it found the problems were still there. They hadn't been solved.
Most tenants of Dolphin, St Teresa's and Croke Villas are paying rent for the privilege of living in these conditions.
People do pay rent. And people pay significant rent in some cases. Some people that I have met.
Dublin City Council said it was continuing to regularly meet with Dolphin residents to further regeneration plans, but it would not comment on the problems they face while they wait for regeneration. Neither would it comment on its attempts to put it right.
The council installed ventilators in 6 flats to address the condensation and dampness. That didn't work. They didn't work. It also tried cleaning some of the wastewater stacks. It worked in some flats but didn't work in others. Broadly, the survey showed that the attempts they have made haven't addressed the fundamental problems in here.
Residents are critical of the tendency of the City Council to blame them for the damp and drainage problems.
A lot of it they're saying it's...
Dublin City Council declined to take part in this report. It said that in Croke Villas, detenanting was continuing, but that it was now considered appropriate to consider other alternatives to demolition. In St Teresa's, the City Council says it is working on options for regeneration, but that it was not possible to say when agreements, approvals and funding would become effective. And the City Council says it is working on options for Dolphin House too, and that currently partial refurbishment and intensification is being considered in more detail.
People in here want the housing conditions addressed. Now, whether that's through refurbishment or complete demolition, the key thing is that they are addressed, and they're also provided as part of a plan that addresses the social issues as well.
Of course, the unspoken excuse from the City Council is that it has no money. But that's an excuse that doesn't wash with the man who brought regeneration to the once notorious Fatima Mansions.
It is absolutely scandalous that we have people living in those conditions, and that the only excuse we can make is there's no money. I mean, that is an abdication of responsibilities.
The government has options. One is to transfer stock to not-for-profit housing associations who take tenants from council waiting lists. They say they're willing and able.
We need to be measuring. So yes, we have the willingness, we have the appetite and we have the capacity to do that.
The social dividend promised in the legislation that set up NAMA is another option. NAMA has yet to show its cards, but it says it has met the new minister.
If we as a society are going to get through this crisis, those at the bottom need to get a dividend as well.
So there is a major decision to be made.
Back at Croke Villas, tenants who want to stay there hate what they are living in.
When I get off the bus and walk in here, it's like a dead avenue. Now it really is.
I think they gave us all false hope. Promises, 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 kept us on the long finger.
It's now up to the minister to show in the new government